And this is also common.
I brought over the proposal, and I need for you to tell me what you think. All right, let's take a look. You look at page 2, there's a high-level view of the copy. Actually, you know what? I think I have my own copy. Right. Are you choking? Can I help?
A business lunch with an associate can turn into something entirely different when he starts choking. Choking in adults is often caused by food blocking the airway. The block in the airway may be mild or severe. If it's mild, the person can make sounds and cough loudly.
This is mild block, mild choking. He can make some sound, he can cough, he can breathe.
In this case, stand by and let the person cough. If you're worried about the person's breathing, phone 911. If the block in the airway is severe,
Now, severe block, this is an emergency.
the person cannot breathe, talk, or make sounds.
So the patient cannot do three things. He cannot speak, he cannot breathe, he cannot cough.
Yeah.
Keep it in your mind like that. 3 nuts. Cannot breathe, cannot speak, cannot cough. Okay? Or can be without sound. Cannot cough.
This is a hard situation, by the way. I noticed it because, yeah.
Have it?
Yeah, really, 3 times.
With
Yeah,
who?
so I witnessed this situation 3 times, really.
Oh,
It's so hard.
yes.
Yeah, and you reach the death and خلاص. شهدت بقى. آخر مرة شهدت خلاص خلاص.
Person may also make the choking
Sometimes
sign by holding his
the neck
throat.
like that.
If this happens, you need to act right away to try to clear the airway. When a person's choked,
Look what happened exactly. Understood what exactly, huh?
Yeah,
Okay.
you need this.
Look here. Nose, mouth. There's a way from the mouth, we see oral cavity. This means a cavity from the nose. 2 ways, correct?
Yes.
But at the end, becoming
One.
one way. That's why you can take the breath from the nose and from the mouth. Correct? Okay. After that, this way, one way, becoming 2 ways. Correct? Way for the breath, going to the lungs. The second way, go to the stomach. Okay? So there's 2 ways, like that. Way in the front, one in the back. In the front, this is larynx, or voice box. Okay? Arabic al-Hanjara. This is the larynx, here. I think you see this one is Adam's apple. Adam's apple, yes. And the behind, there is esophagus. Esophagus going to the stomach. This is for food and drink. That's clear now? See like that. So when you eat, the food to go here or behind? Behind. Esophagus, not here. What happens if coming here? Block. Big problem. You cannot breathe. You cannot breathe through the air, not coming inside, so the lungs will take it from air. It's a big problem. Okay, this is causes of death. Correct. But how? And, we are eating every day, several times. 3 times or 5 times? Tell me the truth. Okay, twice? Alhamdulillah. Right. So we are eating every day. But every day, the food go to the stomach. Alhamdulillah. Why? What happened? Why not coming in the front? Because there is like a door, small cartilage in the entrance. When you swallow food, it closed. So the food will go directly to the stomach. You see this one? See this one? During swallow, closed. So becoming only one way. Okay? Feel it. Put your fingers here in the Adam's apple, all of you. and through that swallow. Move. What do you feel? Move. It's move.
Yeah,
Why
move.
move? Closed. Because you want to swallow. So what you are swallow? Go to the stomach. So you are swallow, alhamdulillah, in safe way. This is automatic from Allah. Automatic. Get that point? Yes. Okay. Why the choking happened? The main cause is you are speaking or laughing during swallowing. You are eating and joking with your friends, and suddenly having like that, and you are swallow and laughing meaning opening airway. Speaking opening airway because the sound produces from the larynx itself. So you have to open the airway during speaking. So how you speak and swallow at the same time? That's why we advise our kids. If the food inside your mouth, don't talk.
Table manners.
Swallow, then you can speak what you want. Okay? Don't laugh anyone he is eating. It's very important. Another cause, moving. Move during you are swallowing. Like what happened to the kids in the schools. They are eating sandwich or something like that, and they are playing. And someone threw it like that, then they will choke. Clear that one? Yes. So during eating also you have to sit in the chair and eat. Don't listen to sound. Eat, chewing, swallow. After that finished, you can talk what you want. And sometimes the problem not with the kids, with their mothers. The child don't want to eat. Sometimes the mother push him. You must eat. Then he run away. Then he run over behind him. He jump over the table under the chair and he try to laugh him. Take it, yes. Hey, okay, start like that. Okay, be careful. Be careful. For giving food, the food is very important. Swallow, okay, the maneuver is automatically safe. But deal with it as correct way. Sit in the chair. You want to eat, you have to sit. Eat. Swallow, then you can talk if you want to talk. Otherwise, don't speak and the food inside your mouth. Okay? How you know this case is emergency? The patient cannot speak, cannot cough, cannot breathe. Okay? Any question?
It's a life example. You should sit down and drink water.
Because I drink water. You have any question?
Yeah.
So small dot coming inside the airway, then I cough. What happened with my cough? What means coughing? Coughing is pushing all the air from the lungs, pushing forcefully outside and remove all the small dots of food in this water. So this is, I can save myself by the coughing. And this is not an emergency. I can deal it with myself. And sometimes a lot of people, they are coughing during taking eat. And also coming with the cuff, the piece of the food, or the piece of the rice or something like that, okay? By your cuff. If the patient can cough, don't worry. It's okay. The coughing itself will remove it. The problem where it cannot cough and cannot speak and cannot breathe. This is the choking sign. Last week. He cannot ask for help. He just signed to his neck. You see what happened with me? I will try to cough, I try to breathe, but I cannot. This is emergency. Clear that point? Sometimes happen another thing. I am eating, especially for some kind of food. Very delicious. Open buffet. And I want to finish everything quickly. So I eat, yes, quickly. Yes, there's a line behind me. Okay, I eat too much now. So I feel that the food stuck here. Then I will shout to my neighbor, please, I want water. Give me water. Please, water. I will. Is it choking? No. Because I can speak. I ask water. Okay? What happened to this one? This one, the food is going to the esophagus normally, to the stomach. But here, stop. And pushing the airway from the behind. So in the correct way. But because you are not showing very well, you should come in the dry. So stop in the middle. Need some water or Pepsi or something like that. Ease it to the stomach. That's why in this time you will eat each time with a little drink, juice or something. You want to come in without chewing. This is not choked. Only afraid because a lot of people they are confused from these small things. When you can afraid, unless only if the patient cannot breathe, very nice. Cannot breathe, cannot speak, cannot cough. Clear? Yes. Okay. So what you do, make abdominal thrust. Abdominal thrust. See.
Choking is severe. Give thrust slightly above the belly button. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If you think a person might be choking and is severe, follow these steps. Ask if the person is choking and if you can help. Are you choking?
So what you do?
Can I help you? If the person nods that he or she is choking and cannot talk, you need to act. You'll need to give thrust slightly above the belly button. Depending on your size and the size of the person choking, stand firmly or kneel behind the person and wrap your arms around his or her waist so your fists are in front. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak, or until he or she becomes unresponsive. An adult who has been given thrust should see a healthcare provider as soon as possible. Let's look one more time at how to make a fist. Make a fist with one hand. Put the thumb side of your fist slightly above the belly button and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen.
Clear? Now I am choked. Ask me. Are you choked? I'm choked. Ask me. Are you choking?
Are you choking?
Yes, help me please. No. What you do? Good, listen. So he got me. So when I'm asked, yes, I'm choked. So this is not choked. He can speak. For patients, he cannot speak. He just only nod his head like that. So what you do? Stand behind him. This is the navel umbilicus. Just above the umbilicus level. The umbilicus above. Your fist like that. The same side of your thumb. Not like that. Like that. More hard. The other hand over it. And push your hands. Like that. Push. Until the object come out. Clear? In this area. Like that. Good. Good. Ask him. Are you joking? Are you joking? Yes.
Choking, not joking. Oh.
Yes, how many plus? Yes, take it, yes. I'm running a next day. Yeah. Show your friends. Show your friends. أيوة. No, not like that. Show your friends.
Okay.
First.
From this.
Yes, no, like that. One hand, yes, yes.
One hand
Ah, yes. The other hand over it. Yes. Do it, push. Yeah. Yalla, do it. Good, excellent. Push more, fast. Good. Okay, the others. You want to make a practice? Okay. Okay, give me. Alhamdulillah, you make some practice. Okay, any questions? This is for adult and for children. What about if the patient is pregnant and chocked? Okay? Or the patient obese with big cash. You cannot surround his abdomen. So what you do? Chest thrust. See
If the choking is severe and the person is pregnant or very large, put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give chest thrusts instead of abdominal thrusts. If you give some,
Clear? Good. Now this patient is not breathing, correct? During choking, he's not breathing. Correct or not? Yes. Not breathing. Why not do CPR for him?
Because
He's unconscious.
Because he responds. If you remember, I told you, must be two things. Not responding, not breathing. But in this case, he's still responding, standing. Okay? But if becoming not responding, and if you fail to remove this object by abdominal thrust, and this is in rare cases, the patient becoming not responding.
someone thrusts but cannot remove the object blocking the airway, the person will become unresponsive. Watch and see how this might happen and what you should do.
Sir, can you
Now, becoming not responding.
be lower to the ground?
Now he is not breathing and not responding. What do you do?
I think they put their feet up. I think they put their feet up.
How much?
I don't know, but I think they put their feet up. They have
Head down, feet up.
Yeah,
Feet
they
feet
put
on
it in the floor and take the feet and put it
No. This is stuck. Hold it like that. Trapped.
Maybe.
You mean to make it like that upside down?
No, not like that. He's in the floor.
Now like that, the person becoming not responding, so becoming not responding, and he's already not breathing. So in this way, you must start CPR. Why becoming not responding? There's lack of oxygen. No oxygen go to the brain. That's why becoming not responding. So he needs circulation. So directly ease him to floor, and remember, call for help first. Because until this moment he is not called for help. He tried while he responding. Now, call for help and start CPR.
Phone 911 and get the AED.
Exactly same CPR as we know. Only one thing more, one thing point, we'll add it on the CPR.
When a choking adult becomes unresponsive, shout for help. Phone or have someone else phone 911 and get an AED. Put the phone on speaker mode so that you can talk to the dispatcher. Provide CPR, starting with compressions. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. But do not perform a blind finger sweep, because the object may become lodged further back in the airway. Each time you open the airway to give breaths, look for the object in the back of the throat. After checking the mouth, give 2 breaths and then repeat 30 compressions. Continue CPR until the person speaks, breathes, or moves, or until someone with more advanced training arrives and takes over.
Okay? Any questions? This is for adult and for child. Also for child, ask him, are you choking? So his hand, his head above the umbilicus, like that, upper hand, and do the abdominal thrust. The only difference, because the child is shorter than adult, so you have to kneel in the ground to be the same. And if he becoming not responding, ease him in the ground, ask for help, call for emergency and bring the AED, then start CPR as we learn. How many compressions? 20 compressions. To breathe, but before give the breathe, check inside the mouth. Maybe after this compressions, move the foreign body, so I will see it. Then I put my finger and remove it. If you didn't see, don't insert your finger. Not like that. Not like me, huh? Like that, you will push it more. Correct? And this is a big problem with some mothers. They put their fingers in their mouth inside. One is called it's like going over to that. See, like that, you push it more. Be careful. Okay? So if you didn't see, just give 2 small breaths and return back to the compression. Okay? Adult, same child. But infant, different. For infant, we cannot make abdominal thrust. Still, the wall of the abdomen and the organs inside, very, very soft. If you make abdominal thrust to the baby,
Bust.
it will rupture everything. So he will not die from the choking, he will die from the internal bleeding. So what you do, we have 2 methods for breathing. Yes.
Choking is also a common emergency with infants. When an infant has severe choking, you need to act quickly. You'll use a combination of back slaps and chest thrusts to help remove the object blocking the airway. Hold the infant face down on your forearm. Support the infant's head and jaw with your hand. Give up to 5 back slaps with the heel of your other hand between the infant's shoulder blades. If the object does not come out after 5 back slaps, turn the infant on his back, supporting his head. Give up to 5 chest thrusts using 2 fingers of your other hand to push on the chest in the same place you push during CPR. Repeat giving 5 back slaps and 5 chest thrusts until the infant can breathe, cough, or cry, or until he becomes unresponsive. If the infant becomes unresponsive, do the following. Place the infant face up onto a firm, flat surface, then shout for help. If someone comes to help, have that person phone 911 and get an AED. If you're alone and you have a cell phone, phone 911 and put it on speaker mode. Provide chest compressions in the same place as you would for CPR. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Each time you give breaths, check the mouth for an object and remove it if you see it. Repeat giving sets of 30 compressions and 2 breaths. After 5 sets of 30 compressions and 2 breaths, if no one has come to help and you do not have a cell phone, then take the infant with you and phone 911 and get an AED. Use the AED as soon as it is available. Keep providing 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions until the object comes out. The infant starts to respond, or someone with more advanced training arrives and takes it.
Okay. Baby. To save the baby and remove the object, you have to sit in the chair, like that. And hold the baby in this position. Let the baby sleep in your arm. And hold the head. Open the airway in straight way. Not like that, in the straight way. Not don't leave the head like that, just only in the straight. And make the head lower than the body with the gravity. And support by your arm, along your arm, not half your arm, along your arm. And support your arm by your leg, like that. See the position? Between shoulder, make back slaps. 1, 2, 3, 4, 5. 5 times. Then support the head and rotate to other arm, and your arm supported with the right leg between the nipples, exactly at the same location for CPR, and give how many thrusts? 5. 1, 2, 3, 4, 5. Support and return. Get back. 2, 3, 4. Exactly 1, 2, 3, 4, 5. You are alternate between back slaps 5 times and just a thrust 5 times. Not abdomen. Chest. Clear now? Until the patient becoming breathe, he can cry. Okay, he cannot speak, of course. He can cry. If he becoming not responding, the same. Make CPR and check the mouth before give the breath. Huh? Questions? Who have baby like that in the home?
Big.
You have baby? Yeah. Yeah. What? Huh? Yes. Yes. Falsely.
Five.
Good. 5 times.
Then
Okay.
5.
Teach that to you guys. Okay? Mothers. Where's mothers here?